that 1 in 4 people will develop cancer in their lifetime? Hello, my name is Fatijona. That being said, can I ask how many of you appear that you will have cancer one day? Can I ask how many of you have tested for cancer lately? Well, you should, because according to the article, Age-Appropriate Screening for Cancer, Evidence-Based Practice in the United States of America, written by T.S. Pandry in 2014, there were about 12.7 million cases of cancer and 7.6 million deaths from it in 2008. Therefore, cancer can happen to anyone. It can happen to you, or it can happen to a close family member or friend. Therefore, we should raise awareness about early detection. I was watching the news one day and one of my favorite comedians named Ben Stiller came up. He revealed that he saved his life by taking PSA tests, which are tests used to screen men for cancer. At age 50, he found out he had this disease and chose to remove it by operation. This inspired action in me, so I did some research on how common cancer was and how early detection can benefit me. Today, I will explain how early detection, how every single person can detect for cancer before it's too late. First, I will explain how common cancer is. Second, I will explain how and when you should test for cancer. Thirdly, I will explain how this will benefit you. So I'll begin by talking about how common cancer is. Cancer is a disease caused by abnormal cells dividing uncontrollably and terminating body tissue. Science estimates that by the year 2030, there will be 20 million cases of cancer. Therefore, we should all test ourselves. The problem is that with these large expectancies, we should take more action for early detection. The need is more awareness for the early detection. We should have more counseling services that inform people about early detection for every single person. For instance, almost every woman has fears of breast cancer because it is the most common cancer for them in the United States. In 2011, it was reported that there were 230,000 cases of it and of this cancer and over 39,000 deaths from it. Cervical cancer is the third most common cancer for women. There were 500,000 new cases of this, and annually it kills about 40,000 people. Colon cancer is the third most common cancer for both men and women, and it is the second leading cause of cancer death in the United States of America. In 2012, it was estimated that there were about 103,000 new colon cancer cases and over 40,000 new cases of rectal cancer. In total, over 51,000 people died. Men should take utmost care of their prostates because prostate cancer is the most common cancer for them. The American Cancer Society predicts that there will be over 241,000 new prostate cancer cases. In 2012, over 28,000 people died from it. According to this chart called by article 4 Essential Charts of Cancer by Hope Crystal in 2016, women are estimated to be diagnosed with breast, lung, and colon cancer, and men are estimated to be diagnosed with prostate, colon, and lung cancer. As you can see, cancer can happen to anyone. I'm sure that you can see the need for everyone to get screened for cancer. The class is aware of how common it is, but you might be wondering when and how you can get tested for cancer. Let me apprise you. This is how you go about getting tested for cancer. First, talk with your doctor and do some research. The recommendations will be extremely helpful. For instance, the United States Preventive Task Force Service, experts in improving lives of the United States residents by recommending screenings, counseling services, and preventive medication. For example, they suggest that women between the ages of 50 and 74 should be screened for breast cancer. The screening would be typically done through mammography. For cervical cancer, they highly recommend that women should be screened with cytology and tested for HPV. Women between ages 21 and 65 should test with cytology every 3 years, and women between ages 30 and 65 should be tested with cytology and HPV tests every 5 years. For colon cancer, they recommend that people between the ages of 50 and 75 get a colonoscopy every 10 years. For prostate cancer, it is suggested that men ages over 40 should be screened with PSA blood tests, digital rectal exam, and ultrasonography. Early detection can save lives. For instance, the article Early Detection of Ovarian Cancer, written by Donna Bagwell and Robert Bass in 2007, states that women, when they are diagnosed in ovarian cancer at stage 1, 90% of them can survive using chemotherapy and operation. Now that you heard about when, and how you can get tested, let's look at how these early detection tests will benefit you if you do. According to the British Journal of Cancer, published in 2014, screen-detected tests of cancer have a high survival rate. Imagine one day you go to the doctor's office for a simple checkup and they tell you you have cancer. Well, this can happen to you if you do not get tested. You can have cancer if you are not taking care of your body and if you are not getting tested regularly as recommended by doctors. However, when you screen for cancer, you have a greater chance of terminating it. Early detection of cancer proves that you are in total control of your life and you can save your life by doing it. In conclusion, you can easily say that early detection of cancer is extremely important. I know that many of you think that ignorance is a bliss, but however, I believe that if you ignore this problem, it can get worse. I've told you how common cancer is, and I've also told you how and when you should get screened for cancer, and I've also explained the benefit of early detection. Remember that 1 in 4 people will develop cancer in their lifetime. It can happen to you or it can happen to anyone. You can use recommendations from the United States Service Preventive Task Force. Early detections of cancer save lives, so please go see your doctor and start testing for any possible cancers. My name is Fatijona. Thank you for listening.